I'm here with Lisa Clatney from the Saskatoon Community Clinic, a community health center in Saskatoon. How are you today?
I'm good, thanks.
Perfect. So, to start off, please tell me about the Saskatoon Community Clinic, the client base that you serve, and the community that you help over there.
Sure. So the Saskatoon Community Clinic actually came into existence in 1962. And so we kind of have our roots in Medicare and something that we're very proud of. And we're actually celebrating our 60th anniversary coming up this year, which is pretty exciting
Oh,
for us.
wow.
We have two clinics in Saskatoon. So we have one in the downtown area, and we at that clinic we serve a very diverse group of patients, both in terms of age and socioeconomic status. And then we also have a second clinic location located in Saskatoon's west side, where we serve a much more under-resourced population. And so at our West Side Clinic, we kind of operate both as a blend of booked appointments and walk-in appointments. We typically see across the two sites about 14,000 patients per year. And even though the composition of our teams look a little bit different depending on which site, we do have a very robust interdisciplinary team model and approach at both of our clinic locations, which includes practitioners such as physicians, nurse practitioners, pharmacists, mental health counseling, outreach dietitians, lab, OT, PT, just to name a few. So it really is an incredible model where the entire team comes together to care for our patients.
That's amazing. So, how would you define the current situation in Saskatchewan in terms of community health centers, and why do you feel that you need to have more community health centers in the province?
Sure. So, I mean, the short answer is we don't have enough. We only have four community health centers in Saskatchewan, and they're kind of spread out amongst the different cities, and one is more in rural area. We're the only one in Saskatoon. Um, so I would say access to community health centers is definitely an issue in our province. The way we practice at both locations is really kind of that low barrier, high tolerance, opportunistic care, and particularly at our West Side location. And so what we find is, as opposed to your typical fee for service family physician office, where you're able to pay more or get paid more or hire more physicians based on the number of clients that you're kind of seeing every day and the number of services that you're billing for. How our funding model is set up is we're kind of given a set amount for our staff salaries. So what we find is that we're not able to meet the demands of the clients that we serve. And typically, even though we were very fortunate to have increased funding the past couple of years to increase our hours of operation at Westside Clinic, we still often are sending people away because we just can't accommodate everyone that needs access to our service. And the pandemic, frankly, and I know our community health center is probably not unique in this, that it really amplified the inequities that were already in existence with some of the more vulnerable populations we serve. And so as a community health center, the Saskatoon Community Clinic, we saw the need that existed even in the early days of the pandemic, and kind of the lack of planning that was created and in existence to serve those vulnerable folks. And so we quickly worked with our community partners, because that's something that I think all community health centers are very strong at doing. So we worked with our partners to innovate and really create those spaces for healthcare and social supports to happen. But what we're still finding in our community is people are telling, you either have COVID or you're a close contact, you need to self-isolate. They don't have access to the social supports that most of us have,
Yeah.
right? They can't afford to buy groceries online, have them delivered. They can't afford childcare so that they can go to work. They can't afford to miss work themselves for the social isolation period. They might not even have a home to social isolate in. So when you couple that with all of the challenges with shelter and transportation and housing, it's a recipe for disaster. And so I think what we've seen as a community health center this past year in the pandemic is we really need a broader, more integrated, coordinated approach to how we deliver primary health care in the province and in the country. And community health centers that's their strength, because we don't just look at one particular health issue that a client is experiencing. We really have that whole person approach to care, that wraparound to care, and that's what our most vulnerable populations and our community members need right now. That's what they're searching for, and that's where we've seen the greatest improvements in health outcomes, is when we can just not focus in on one individual problem, but actually look at them as a whole and understand what the issues are. Because to tell someone, why aren't you taking your medication, or you need to do this to take care of your health, they're struggling in so many other areas. We need to address all of that so that they actually have the time and the capacity to look after themselves and be engaged in their health care.
So considering that, as you just said, you're the only community health center in Saskatoon and all of the services that you need to provide, and you touched on this a little bit, it was a great answer, and I'd love for you to elaborate on how increased federal investment in community health centers what it would enable you to do to improve the health and well-being of all of those people that you just mentioned.
Sure. Well, I mean, community health centers fill so many gaps in the community. As I mentioned, we provide healthcare, but we also seek to address all of the other range of needs that people have and those issues that are affecting their health and well-being. So whether it's housing, food security, life skills, group programming, things like that, and I think community health centers are uniquely positioned to fill those gaps in the community. One of the strengths of the community health centers is to build trust, not only amongst the people that we serve, but also amongst our community partners. And so although community health centers look different, one of our strengths is that we are very closely attuned to the needs of the community. And we strive to kind of work with clients to meet them where they're at, as a starting point, and to work with them to improve their health and well-being. And that sets us apart from other models of care that you might find in a city. To be honest, Saskatchewan, in our community in Saskatoon, we're in crisis mode right now. I mean, the pandemic is one thing, but even before the pandemic happened, Saskatchewan has the highest incidence of HIV nationally. It's tragic. We have an HIV crisis, we have an opioid crisis, we have a syphilis crisis. I mean, the list goes on, and we simply don't have enough resources to take care of everyone that needs help. We have such a strong model, and we have the right team members in place at our community health center. We work well with other partners and organizations in the community. We have a model that works. We just need more investment to do more of the good work that we're already doing. And I think that's where, if community health centers, if even just speaking with Saskatoon Community Clinic, if there could be more of an investment in that, we would be able to just expand what we're doing and get some of these crises, I think, under control.
Wonderful. I want to thank you so much for your time today, Lisa.
You're welcome. Thank you.